Good morning, everyone, and a thank you. I think a bit of a rude awakening this morning with so many people starting holidays today or closing down shop today. But what an important debate that we need to have today, especially after the address from President Ramaphosa last night. Graham Codrington called it this morning when we were chatting the family meeting. And I think definitely after the family meeting last night and the discussions that we've been having ourselves, and I'm sure all of you have been having the debate with your families, your colleagues, etc., that this is a crucial discussion at the moment. So I need to tell you is that we were surprised that, well, some people were surprised in terms of how many people registered for this morning. We literally sent out the invitation, as you know, on Friday. This is the shortest notice of an event that we've ever given our members in our database. But really, the mere fact that this discussion needs to take place now. And so we've got almost 200 people that have registered within the 3 days that we released the event. And I think it's fantastic. And I think what it really shows is, of course, the debate needs to take place. We need to know what's going on. We need to hear from the experts in order to make the right decisions and to really understand what the landscape looks like. What do we need to do? How do we handle this? Such a fine balance that we're going to have to find. And and listening to the president last night, I thought what a difficult job that is. Again, there've been so many times during this year where I thought, gosh, this is a very, very difficult job for anyone to have, and the decisions to be made. And then to basically, say we shutting down beaches, etc., and to be able to be that bearer of bad news. This really started last week, Thursday, for us. So from a personal point of view, a family member sent me a News 24 article on Thursday saying, Jill, we're not going to be able to go to the beach in a couple of weeks' time. KZN beaches are closing. And there was the article in News 24, Christmas cancelled, irrational advice to shut down all KZN beaches. So obviously my instinct was like, oh no, my holiday. But then the discussions amongst people started, and what it did, it spurred off a debate with my colleagues that are around the country. So as risk professionals, I mean, the first thing that we do is we start with our networks having discussions. How are we handling this? What do you think the right things are to do? What are the various scenarios? And so those discussions actually started with some of my colleagues down in KZN, our chairperson of our KZN committee, Amit Suknandan. We had a discussion what's happening down there. Then with Jay Ramarak from KZN Provincial Treasury. And so the debate started with us, and then Becky Gutschwa, who many of you know very, very well. So we started having these debates, and it got to a point where I actually said to Jay, this is not a debate just for us. This is a debate and a discussion that we should be having with our members, because what was coming out was just so valuable that at that moment on Thursday afternoon, we decided, let's do this. And so it was like, wow, but this is going to be a challenge. People are closing on the 16th. So from the 16th, there's the public holiday. We need to do this on Tuesday. So very quickly, the dream team got together Friday morning, 7 o'clock in the morning, from our team with Roxanne, Christopher Palm, Valerie Pillay, Cobus DeVet from our dream team. At that point, our PR company, RURSA, and then with Jay and Amit as well, and we started this robust discussion. And I need to tell you is that by 10 o'clock, we had discussions with our speakers today, with Jeremy and all of our fantastic speakers, to say, would you like to be part of a discussion? And, again, at first was every speaker was absolutely, we need to be there to have this discussion. It is imperative right now, a vital conversation. So to Graham Codrington, Prof. Ian Sane, Darashan Naidu, Ndabo Khoza, Dr. Azar Jamin, and Mzimkhulu Msiwa, just for coming together so quickly, and for us to be able to get that invite quickly out to the members in the database to say, we are having this debate, you need to join us. And I think we show again how risk professionals need to be agile, we need to be flexible, we need to be able to respond very quickly to what is happening on the landscape. There's no time to sit and wait and see, okay, let's see what happens. This just shows what needs to be done. So thank you to all of you for being here this morning. Thank you to our speakers. And Jeremy, thank you to you for responding as you do for IRMSA always. Thank you for being here. Jeremy, I'm going to hand over to you, and I'm going to really sit and just take huge notes, because obviously it's impacting all of us at the moment. It's impacting how we're going to operate as an IRMSA, how our members are going to respond. And then, of course, even personally, Jeremy, for my family and my friends that are looking at going on holiday, there is just so much that is impacting the country and such a worthwhile conversation. So, Jeremy, thank you so much. And I'm going to hand over to you.
Jill, thank you very much indeed. And while you've been making your introduction, I've been looking at my diary from exactly a year ago. And this is what it says. It's all very innocuous. It says, pump Lilos, get Christmas crackers, and confirm tickets for Arsenal-Manchester United game on New Year's Day. Because on Christmas Day last year, my wife and I flew to London on holiday. And my goodness me, 365 days later, how things have changed for all of us. And I think, Jill, it's fair to say to all of you that things really got real for South Africa again last night, with less than 2 weeks to go until Christmas. I suppose, and we will explore this in our panel discussion over the next hour, things probably could have gone worse, but let me just recap very quickly for you. As of midnight, South Africans start the festive season with an 11 p.m. curfew, even earlier in the so-called hotspots. Restricted hours on the sale of alcohol, and no access to beaches on the busy garden route in the Eastern Cape. And this was all coming in an attempt by President Ramaphosa to tighten restrictions to combat this so-called second wave of coronavirus. And I'm not going to go over the statistics. They are concerning. So in this special webinar from the Institute of Risk Management, I'm going to ask the question today to our august panel, and Jill Lacordia, you have already introduced them. I'm not going to do it again. We're going to talk about what our risk appetite is right now, what our risk appetite should be. And the notion is, should we cancel or curtail Christmas? I think that's over-amplifying things slightly, but that's just my view. But I'm looking forward to hearing what the panel members have got to say. At some point in the next hour, I'm going to announce a poll. So the 130 odd people that are listening to us, watching us right now, can participate in it. But we'll get to that in a little while. I want to start with Professor Ian Sane, if I can. Ian, it's good to see you as always. And my question to you is very simply, is this the right response from a medical perspective? This is what this is what President Ramaphosa said, and I quote, "We have undertaken extensive consultations on this issue so that we can find an approach that reduces the risk of large-scale transmission while limiting the negative impact on businesses in coastal areas." What's your early assessment?
So, Jeremy, good morning, and to all the listeners. So yes, indeed, the Minister of Health did consult widely before making advice to the National Command Council. So I mention him particularly because I am a member of the Minister's Advisory Committee, and we spent quite some time debating the merits of further restrictions. There's no doubt that there's an expanding epidemic. I think that we are in the second wave. How we handle this part of the second wave will determine whether we follow a trajectory that is similar to Belgium and Germany, where things are still climbing, but in fact are relatively under control, or whether we follow a trajectory such as the US, where indeed everybody it goes economy first, and my holidays first, and my everything about me, and what pleasures I can have, instead of actually taking into account the risk that those transmission events make. So the rates in the US, the first 1 million cases in the US took something like 3.5 months to emerge. The US now has 1 million cases every 4.5 and decreasing days. The hospitals in the US are completely overwhelmed. I have colleagues at Vanderbilt who do not have ICU beds anymore, even in the US, who do not have high care beds anymore, and where the death rates are likely to rise because they are unable to apply treatment. So to South Africa, I have worked since the beginning of the pandemic on the disaster medicine side, on the hospitalization component of this. That's where we chose to focus our attention. We have disaster medicine support for the Eastern Cape, for Free State and Mpumalanga, and now the Northern Cape. The Western Cape has outstanding team itself. They're pretty much the disaster medicine center of South Africa, so they have done a sterling job. And I will tell you that from the beginning, we were always worried about the number of beds. We recommended searching beds within hospitals rather than building field hospitals. But indeed, we have seen a rapid rise in the hospitalization rates at this time. It is about, from our epidemiology and economics group, it's about 6 weeks earlier than we expected the second wave. Therefore, the rising rates it's a very steep curve. It really knocked us on the head in the Eastern Cape. Within 3 weeks, all hospitals were full. And the other provinces are following at present. I think that people need to realize that the healthcare sector is stretched. Other health services are open now. And indeed, at Livingston Hospital in the Eastern Cape, at last count, there are 100 complex fractures from trauma, at least 50% of which is alcohol related. That actually are waiting theatre surgery, but there are no theatre sisters because half of them either out on COVID or in fact have been repurposed to the high care units, and doctors are in short supply, and so these 100 patients waiting for surgery are literally a continuous waiting list. So in terms of risk, the healthcare workers are exhausted. I was in a meeting with the top clinicians of the Eastern Cape, and indeed, we watched grown clinicians cry. So proper head of department saying they cannot actually do this anymore, and that they are overwhelmed in providing the service to the public at the same time as dealing with the extra burden of large numbers of patients. Indeed, I also have supported the field hospital in East London. The sudden rise in cases left them in a shock factor. They had actually reduced the number of staff because we thought we had a quiet period. We had to overnight hire 136 care workers to permit task shifting away from nurses into actually allowing other people to, in fact, look after patients. Their high care and oxygenated beds weren't enough, so we're scrambling to actually put down more reticulated beds. We're scrambling to buy oxygen reticulators, oxygen concentrators. We are scrambling to recycle the cylinder oxygen in the Eastern Cape. So the rural hospitals are running out. Patients are literally sharing oxygen tanks. Those each last about 4 hours because of the high volume that we need to deliver. So I think from a medical perspective, this is extremely real. From a transmission perspective, I think that we had the perfect example at Rage. If you party and revel and share bottles and share Zol, as Minister Dlamini Zuma pointed out at the beginning of this pandemic, transmission of COVID is extremely easy. And so this is a real disease with a very real consequence. We can debate the beach closure. And I would say to you, it's not about the transmission, not only about the transmission on the beach, it's all about the volumes of people that move to the beach. Right. And ultimately, it was each premier ultimately decided, I think, I have no inside knowledge, but from the MAC perspective, we did give options. and each premier,
Professor,
I think,
I'm going to interrupt you at that point. I just thank you for the overview, first of all, and it's a lot more gloomy than I thought. I want to bring in Dr. Azar Jamin as we look at the medical consequence, and now we're going to look at the economic consequence. Then we'll get real, just in terms of direct impact. So, Dr. Azar Jamin, you've been listening to Professor Ian Sane. It is not an optimistic picture that he is posing at all. What concerns me is that we've hit that second wave. I think he said 6 weeks earlier than his modeling would have suggested. Whichever way you look at it, Azar, this is going to have, over this busy festive period, an impact on coastal economies.
Without a doubt. I think what depressed me yesterday was the inconsistent application of the ban on going to beaches, especially in the Eastern Cape and the Garden Route. I think we're going to see quite a lot of people possibly cancelling their holidays or returning early. It's interesting that the government introduced this a day before the majority of people would go down to their holidays. And it's in particular small businesses that are going to suffer enormously. This has been a problem with the whole of the COVID-19 crisis and the response to it. But especially in areas like the Garden Route and the Eastern Cape, a lot of people depend on this peak holiday season to provide them with the financial means to see through the rest of the year. And there was nothing in the president's speech to go hand in hand and say, well, we will supply you with additional COVID-19 relief that we actually saw. And I asked myself, Professor Zane said part of the problem about beaches is to limit, not to have too many people all together at the same time. Then I asked myself, well, then why are KZN beaches being absolved of the need to shut down right through the Christmas season, but only on public holidays? Whereas in the Eastern Cape, where arguably the beaches are much more vast and social distancing is far easier to happen, that's where we have the shutdown. So I find this a little bit inconsistent in terms of the most recent measures. But I do believe it's going to have a knock-on effect that is longer lasting. A lot of these businesses already suffered during the course of the year due to COVID, but it was not their peak season. Now they're going to have this added whammy that is going to wipe out a lot of the tourist industry in the Garden Route. And I ask myself whether it'll inflict permanent damage in terms of people's willingness to visit the region, and especially in due course, foreign tourism coming to that region, which is one of the most popular with foreign tourists. The good news is that, and Professor Zane can comment on this, yes, the number of infections over the last 24 hours were just over 5,133, which was easily the lowest number of new infections in the last 5 days. But what has been interesting in the last couple of days, and this is why I was quite critical even last week when President Ramaphosa restricted the additional restrictions to Nelson Mandela Bay. And I said, why doesn't they're modest restrictions that are going to have limited negative impact on the economy. At that time, there was no talk of shutting down beaches. And I said, why didn't he spread that straight away to other regions and, if necessary, to the country as a whole? I think the government came in too late and they've missed out. The horse has bolted already. And I think the horse has bolted yet again. If you look at the latest number of infections, KZN has easily overtaken the Eastern Cape yet the restrictions are lighter for KZN than they are for the Eastern Cape. So I think there's a bit of tardiness in terms of the implementation of some of this risk management.
Dr. Azar Jamin, I sense that horse that you're talking about that's bolted from the stable. I'm just looking out of my study window and I can see it way over the horizon. Ndaba Khoza, you're the Chief Executive Officer of Ushaka Marine World. It is a popular tourist destination. It would be, I imagine, a time when you are expecting maximum footfall. I have just got a call from a close friend of mine who was going to KwaZulu-Natal tomorrow on holiday. and they are no longer going down. Conceivably, they might have visited Ushaka Marine World and they would have spent money at your complex. How are you responding to the second wave announcement last night and the measures that have been taken? It's going to have a very severe impact, I would imagine, on coastal tourism and an entity such as yours.
Thank you very much, Jeremy. I think, yes, it's going to have a huge impact on us. We had already, the type of business that we're in, we make money 4 times a year. We're very much dependent on the 4 big seasons. That would be December, obviously, which is the biggest one, the Easters, June, July, and September. So we missed the Easters, we missed June, July. We just got the tail end of the September period, obviously, even though the holidays were a bit twisted. And then we're hoping that things were going to look much better. We've done an adjustment on our numbers, but obviously we're worried about a couple of things because normally we run at about 8,000, people within our park. We had already adjusted those in terms of trying to comply with all the regulations to about 3,000 in terms of the numbers. You can just see moving from 8,000 to 3,000, considering that the footfall brings about 53% of our revenue. Now, having to reduce those further is obviously going to have an immense impact in terms of what we are about, and particularly looking at those 3 big days, that would be on the 16th, that would be on, the 26th and the 1st. That's where we would normally get huge numbers of people, not just coming to the park, but also coming to the restaurants and all those things. So we're now sitting down with the team, trying to review the numbers and see what we can actually take and how then we need to adjust some of those. We also, even including that part, just challenges of enforcement in between, because now people will be then flocking in between the other days coming through here. And how then do we manage those things in between? So we are worried about the impact of that, but as a team, we are prepared, and we're hoping that the other days are going to assist us in terms of then creating the balance, but it's not going to be the same.
Let me bring in Mzimkhulu Msizwa now, who is the chairperson of the Provincial Planning Commission in KwaZulu-Natal. Mzimkhulu, you've heard Ndabo talking about the impact on Ushaka Marine World. Tomorrow would have been one of his big days. That's not going to happen anymore. From a provincial perspective, what is the view as far as KZN is concerned, and how is your thinking and strategic planning going to have to change?
Thank you very much, Jeremy. Just the Provincial Growth and Development Strategy of KZN is, as with all other development plans, is about, of course, increasing productivity, increasing employment, and also increasing the incomes. Naturally, the state that we are finding ourselves, both as a country as a province, actually impacts on these 3 aspirations that are carried through in our growth and development strategy. It's a delicate balancing act, the issue of lives and livelihoods. Naturally, closing the beaches and so on is focusing perhaps on protecting lives, but also the issue of partial closures and some closures is also trying to balance the issue of livelihoods, which is actually critical. And I think, as Aja has indicated, the SMEs and the small businesses and also the sustenance efforts of communities depend to a large extent on these peak periods, which is sort of the Christmas, where suddenly there's money, or what I would call helicopter money, coming in the form of an influx of people, and naturally the ripple effect of that in terms of the sustenance of communities becomes quite good. We naturally would want to indicate that the Christmas period, it's not about the Christmas period as far as we are concerned. It's about the events, the risky events that are actually associated with large gatherings. And I think the president yesterday was actually quite clear in terms of actually trying to communicate that message. Our goals in the provincial growth and development strategy are going to be impacted. The COVID-19 is a major risk to the provincial growth and development strategy, and we will then have to devise, as all partners, mechanisms to actually mitigate sort of the consequences of COVID. We were hoping that we wouldn't get into the second wave. There were starting to be very good signs and promising signs that perhaps we could, with heightened attention on risk, that we could still be able to actually bring in some form of recovery in the economy. So it's a drawing board for the provincial planning to actually sort of advise sort of the premier, because our role is an advisory role to the premier and to the provincial executive of KZN, and maybe to look at some of the targets, but also to strengthen sort of those areas of production without compromising the health of the communities. A shutdown.
It's a very difficult job, Mr. Msiwa, that you have. Graham Codrington, I want to bring you in now as a futurist, and we've just heard Mr. Msiwa talking about going back to the drawing board. He's not the only person that's doing that. Around the country, around the world, people are going back to the drawing board. Do you get a sense that there is a lot of planning on the fly here, or can one really future-proof and future plan in order to mitigate the effects? Or are we just kind of, in many ways, just responding in an ad hoc way?
Yeah, I think, Jeremy, one of the biggest problems is that people think or thought that we were near the end. And, you know, a futurist doesn't predict the future. Nobody can tell what the future is going to be like. But what I've done is I've spent most of this past year reading history textbooks, because this is about the 11th coronavirus pandemic we've had, all the way back to 1918. You've got the so-called Spanish flu, and then we've had others like 1958 Hong Kong flu, 1967 was it Asian flu, and then we've had SARS and MERS. And every single one of these has gone through 3 waves over 2 years. You've got to have 2 winters in both northern and southern hemisphere for these things to roll out. That's, of course, without a vaccine. We've never developed a vaccine before. And so I've been trying to help clients this whole year plan for a 2-year period of disruption, not just 1 year. And unfortunately, a lot of people were kind of saying, well, if we can just get through 2020, as if COVID's got a calendar and we'll suddenly just switch off on New Year's Eve. So for me, I'm surprised that a lot of people look like they're surprised that COVID is still in the system. It's amazing that there's a vaccine. I just was watching the scenes yesterday as New York did their first vaccination. But we know here in South Africa, we are not getting access to that vaccine in the first half of next year. And so at least, and it may be longer, and there's still a whole process of getting people to accept a vaccine. So I really do think that people need to adjust their thinking, and realize that we may only be halfway through our engagement with this pandemic. And I think if you start with that as your mindset, a lot of other things fall into place in terms of realizing the level of disruption. As Prof. Sane said right up front, the level of this disruption is insane. Every time we've had a COVID or a coronavirus pandemic, the second wave has always been the worst. So we're heading into a tough time, and we need to take that seriously. I just want to add two other things, Jeremy, just on top of what's already been said. I think what people need to also take into account is the impact on the healthcare system. My understanding of the differentiation between Eastern Cape regulations and then KZN and Western Cape, especially around the beaches, as Dr. Jameen was talking about, has got a lot more to do with the capacity of the healthcare system in those provinces rather than just the beaches themselves. And the Eastern Cape is full up now. There are no more places, as far as Professor Sane can verify that. And, the president announced last night, 38,000 healthcare workers have tested positive for COVID. Nearly 400 in the public sector have passed away because the exposure they have to COVID means they get a much worse version of the disease and are impacted by it. And I think people need to take that into account as they make their decisions. It's not just about us and our holidays. It's not just about Christmas. It's about the impact on the whole system, and especially the healthcare system. And the other impact is also around this concept of long COVID. I think too many people just look at the death rate, which we've done a remarkable job in this past year of reducing. So yes, 1% or even less than 1% are now passing away. But my understanding is that closer to 20% have long COVID, which is not just dealing with the disease over a long period of time. I know people who's still dealing with the after effects of COVID 3-4 months later. But there's a growing concern that those people in particular might have lifelong impacts. Heard of a story of a 17-year-old boy, he's a vice captain of the school rugby team, got COVID. COVID hit his pancreas. Overnight, he turns diabetic, and he will be now diabetic for the rest of his life. This is a South African story. And it's now hitting young people, as the president reminded us last night. And if it hits one of your major organs and gives you a lifelong impact, this is not just something where we're dealing with a 1% mortality and everybody else is fine. I think we've got to take this seriously and realize, I think we're only about halfway through it.
Graham, thank you very much indeed. Also, very honest in your assessment. You talk about one thing, and that's this COVID virus doesn't have a timetable. It doesn't have a calendar. And I think you're absolutely right. So many of us were saying, well, we'll get to the end of December, then everything's going to be all right come New Year's Day. And that is definitely not going to happen. I want to come back to immediate impact. Ndabo Khoza from Ushaka Marine World was talking about the immediate impact on his business. He was expecting massive crowds tomorrow. That is not going to happen. Let me bring in someone now who works in the hospitality industry as well, and that is Darshan Naidu from Coastlands. It is a popular conference facility and hotel facility. And Darshan, good morning to you. And I'm assuming that you would have watched the president's speech last night with an equal amount of concern, given that your business, if it hasn't been negatively impacted already, is going to be, I mean, to all intent and purposes, the live conference industry is dead in the water.
Absolutely, Jeremy. Can you hear me?
Loud and clear.
Okay. Look, Jeremy, there's two things I actually need to address. One, I wear two hats. One, firstly, as the human resources director, and secondly, the board member of this company. And like you clearly said, from a company point of view, the conference and events business ever since lockdown has been completely destroyed or decimated, if I can say that. Hence, hundreds, if not thousands of jobs have been seriously impacted. But obviously, We understand the reasoning in terms of due to COVID-19, lockdown regulations, we understand that. From the human resources point of view, and this is something I'd like to touch on, we seriously, I don't think everyone is aware of how impactful this has been on the average employee, on the individual that's actually earning the minimum wage. Yes, we are appreciative that the government has introduced the TERS employee scheme, which has assisted. However, there's been situations where from the month of September, employees have not been paid. It is now December. Many hotels around KZN simply do not have the resources anymore to assist their employees. Now, as Mr. Nkosa was saying, the impact that this lockdown over Christmas is going to have, this was going to be one of the busiest times for the hotels to actually recover. So obviously we have to sit down around the table now. We were actually going to do it this morning, but I had to excuse myself from that because I felt this was urgent. We need to sit down and re-strategize. What is the plan for Christmas? Are we going to have a Christmas dinner? Are we going to have a Christmas lunch? We're obviously not going to have a New Year's Eve party. And the consequences of that for both the hotel industry and its employees are catastrophic.
Okay, Professor Sane, I would like to bring you back into the conversation if I can. I want to pick you up, and Darshan will get back to you a little bit later. But Professor, you were talking when you started our conversation about all of this in terms of modeling, arriving 6 weeks earlier perhaps than was planned for. There was always going to be, you suggested, a second wave. In terms of the 150 odd plus people that are watching us this morning, who are all risk professionals, how do they need to be engaging with this in terms of planning going forward? The restrictions that were announced last night, are they really going to help?
So I think there's so many levels of risk associated with the current situation. I do think that, I mean, I'm not just an academic professor. I also have built up a non-profit entity with over 4,000 employees across 3 countries. And indeed, I am faced from a business perspective with the risk of travel to Malawi, where we've just got one of our senior people went to write a grant and has ended up COVID positive and is not well. So I understand risk and risk mitigation very substantively. I think at this point in time, the financial risks to the entertainment industry are completely recognized. And I do agree that some sort of mitigation or support for that industry needs to be identified and to be continued. Equally, we do understand that the transmission of COVID indoors is a major issue, and it is the restaurants, it is the reveling, it is the nightclubs, it is the free people's concerts that in fact we are most concerned about. And the decisions by the various provinces on their beaches and which restrictions would be applied to the beaches is actually related predominantly to the to attracting the population to the Eastern Cape. At this time, the Eastern Cape has made a decision to close beaches for the duration of the festive period, not only to reduce transmission on high volume dates in the Plettenberg Bay area, but indeed also to that Plettenberg Bay happens to be actually in the garden route. I realize that, but not to reduce the volume of people on the beaches, but also to actually reduce the number of people that come to the Eastern Cape. And it is serious, and it's got to do with the fact that the health system is unable to deal with additional trauma, with the additional volumes of people at this time. So each of the IMTs in the provinces went through this in detail. The Western Cape felt that they were in a good position, and they felt quite strongly that they could in fact keep everything open except for the garden route, the Eastern Cape, and I think it's a reflection. The beaches are a reflection of the entire sort of restrictions model. And KZN, they were most worried about the very high volume dates. I do think if the rates in KZN keep going up, KZN will join the higher restriction level of the Eastern Cape very soon. So it really depends on whether people are willing to mask. But at this time, the rage incident did in fact give us a very good set of data that showed, you know, a nearly 80% transmission rate amongst revelers. So the entertainment industry also, to some degree, have themselves to blame, that they did not actually, that this sort of attitude, we're going to make this party, we're going to have a big alcohol party, we're going to have good fun, you know, that unfortunately led to the restrictions. And everybody was ready to open the economy. And if I take you to the insides of the debate on the beaches, I think South Africa, the starting point was let's close all beaches. So we managed to, the clinicians in the team managed to say that we need a differentiated approach dependent on risk and dependent on the actual healthcare setting. Within the business, we have continued to do significant screening. We have apps running for all of our staff across the entire platform. We've had 1/3 of our frontline working staff getting COVID. We've actively managed those cases. We've actually had 3 deaths within the Right Care group from COVID, very sadly. In clinicians who actually worked on the front line, who got it at work, and that was deeply saddening. We have bought our own PPE because we can't rely on the Department of Health to try and provide best occupational health and safety. We have split teams, so we in fact have, for the vaccine trials that I'm running, we have half teams. A blue team and a green team, so that should in fact COVID vaccine occur, COVID incidents occur within the team, that we can actually, so this in a gazillion risk. In fact, we have within Right to Care a COVID call that is focused on our activities, but also a standing agenda item is risk mitigation to the organization, and that call is occurring daily. It includes
Professor, could I ask you, in terms of that risk mitigation, how then have you set priorities?
So our priority is to keep the business open. So we're a healthcare business. At the beginning, our board, in fact, felt that we should be stepping away from this. And I said, nonsense, we're a healthcare business. We're going to step towards it. We secured substantive funding from the US government to assist the Department of Health with the disaster medicine interventions. Our priority is to address those disaster medicine interventions, to keep the doors open, maximize occupational health and safety as far as possible. We, for example, implemented the influenza vaccine across all staff and almost made it compulsory. You had to really kind of come with a doctor's note as to why you wouldn't get an influenza vaccine. We have, tried to, we've distributed pulse oximeters and various treatment options to every single employee that got COVID. We have a committee that looks and monitors every person that's admitted with COVID of our staff. We extend that to staff, family members to enable. We've done credible communication. I see your elbow. We've done incredible communication around distancing, and despite that, because these people are frontline workers predominantly, we do think that there's some overlap with risk in transport. So all the staff are now jumping into taxis and going off, and everybody in the taxi becomes your friend, and especially on long distance drives, and you drop your guard, and in fact that transmission is incredibly likely to occur if there's somebody with COVID on that taxi.
Right.
So I mean, this is an incredibly long conversation, but as CEO,
I understand that. I just think that I think that the list of priorities there is useful for all of us. Dr. Jameen, I want to bring you back into the conversation now. Again, I keep coming back to the opening comments from Professor Sane, who talked about all of this arriving 6 weeks earlier. What we read from that is that it is going to accelerate. Things are likely to get worse. So 2021, in terms of recovery, in terms of jobs, in terms of investment potential, how much of a setback is this going to be? And again, if I can bring it back to the risk community, how should they be approaching their planning for 2021 in respect of those topics?
There's no question that it will have a negative impact. I'd like to just allay some of the worst case fears. What we are going to see over this Christmas period is nowhere close to the kind of severity of the lockdown that we experienced in April and May. In this country, and for that matter, what's been happening overseas is also the lockdown measures introduced there are more to mitigate the spread of the virus rather than to lock down too severely. So the negative impact is unlikely of the second wave is unlikely to be anywhere near as severe as it was back in April, May. Unfortunately, that is not great consolation, because it's basically saying that the recovery from an exceptionally low base that we saw in April and May will not be as significant as we had been hoping for. And certainly I found it very interesting to hear Graham Codrington talking about a 2-year time horizon, because thus far I think most of the forecasts have been based on the assumption that vaccines are going to be rolled out next year and that we're going to be back to the races, and therefore we're going to see some recovery. But there will be permanent damage. The other thing that I think people need to bear in mind is that there has been a dramatic structural shift in the direction of business activity as a result of the COVID-19 crisis that is going to be exacerbated by the kind of measures that were announced yesterday. Activities such as restaurants, leisure, hospitality. I think this, in many ways, this is a permanent blow that is being inflicted on them as a source of potential growth in the longer term. And in contrast, we've had a shift towards technological solutions, increased communication virtually, increased online trading, increased emphasis on the environment. And unfortunately, this means that a lot of the jobs that have been lost in the former set of industries may never be regained in the future. And the new jobs are in completely new areas of activity. And it's something that people need to wake up to and amend their personal employment and career and income earning strategies accordingly.
Graham Codrington, back to you if I can, and then I want to go to Ndabo Koza, but this would lead into an area perhaps that you look at. I understand the harsh reality of what you've all outlined over the past 40 minutes or so, but surely we've also got to learn, in terms of managing our lives and managing our businesses, that we've got to balance the reality, and you talk about the 2-year window, with a degree of forward thinking and optimism, given that is human nature, is that we want to succeed, we want to overcome. And what I'm hearing from all of you is a stark assessment of where we are right now. But surely we've also, you know, as a well-known whiskey brand tells us to do, we've got to keep walking.
You know, that one of the flip sides that we could talk about is all of the companies that have had their best year ever. Checkers 6060, the delivery service from Checkers, couldn't have, they launched about this time last year, at just the time you were pumping the Lilos and checking your Arsenal ticket. They were launching Checkers 6060, and I'm not putting words in their mouth, I'm saying this, they couldn't have timed it better. You know, anybody who's in data and fiber supply can't keep up with the demand. They've had great years, as far as I can tell, and of course we'll see announcements on the JSE in due course, but banks and insurance companies and even most of the medical aids haven't done badly, in fact might have done well, and many of our mines are doing very well at the moment with some of the prices of commodities. There's a longer list as well. That doesn't account for the impact on hospitality, conferencing, and so on. And this is the point. We're going to get a number in a few weeks' time, which will be the number that the GDP has contracted by. And that number is entirely meaningless because some industries have been hit with a 90% drop. Other industries have had their best year in a long time. Whichever you were, and unfortunately in this case, it's probably the luck of the draw, because, you know, if you're Ushaka or an entertainment places, it's not your fault what's happened this year. But you're down a lot. Whatever, whether you're down or up, I think the companies that are going to come out of this best are those that have adaptability built into their DNA. So we can have another conference and another one next week and another one in January where we all can bemoan and moan about the situation, or we can take a realistic assessment and say, this is what it is, and now what? And I think those companies that are better at saying, okay, and now what? The companies that have responsiveness, resilience, adaptability, flexibility built into their DNA, they will do the best. So for me, what companies should be thinking about, and what people in the risk industry should be thinking about, is not merely trying to quantify the risk. It's about trying to get ahead of the risk. And trying as risk officers in particular, and I know this is what IRMSA has been on about for the last 2 or 3 years. So go back and read the last 2 or 3 risk reports that IRMSA has produced, because the answers are there. It's not merely about quantifying the risk. It's also about, as a risk officer, being part of the executive function of your business to prepare your business to be more resilient and responsive. Now's the time to step up in that space, I think.
Ndaba Khoza, if I can bring you back into our conversation now, you're the Chief Executive Officer of Ushaka Marine World. There are 2 words that Graham Codrington just used, responsiveness and resilience. You have still got to survive. You still have people coming to your province. There will still be people coming through your turnstiles today, I imagine. When you meet with your staff, if you haven't done so already, how are you going to preach the gospel of responsiveness and resilience, but also under a bigger tarpaulin of risk itself, understanding that caution is your watchword?
Thank you very much, Jeremy. Fortunately, we were always worried about the second wave. Just to give you an example of what happened, we've had to adjust our forecast about 3 times. Just to take into account what was actually going to happen. We were anticipating that the second wave is going to come somewhere in January, that we were going to be able to go through the festive season, at least make up something. Now, unfortunately, we're meeting with our team now at about 11, just to take stock of the impact of that. And I think for us is to try and see how we're going to balance the other days beyond the 16th, the 26th, and the 1st, and see how we maximize it. We also have another issue. I think some of the attractions have similar issues. We cannot do yield management in the same way as the airlines and the hotels do it, because most of the tickets are either sold online, where people buy tickets that are valid for about a year, or they come in here, you know, so you just basically aren't able to maximize the utilization of your existing capacity we've been scrambling, trying to do some changes now in terms of how our ticket structure actually works, and also trying to push a lot of it online so that we are then able to maximize pricing and capacity so that we don't have too many down days and too many up days, but at least we create a balance such that overall we achieve a reasonable number of attendance. The other thing that we are very conscious of is the need for us to be seen to be complying. So we already, as early as November, we put in a very stringent festive season COVID plan. Key thing being enforcement, because we have a challenge that the culture here, because it's a very relaxed place, people come to the beach, so it's very difficult to get them to continuously wear a mask, whereas we screen them as they come in, but as soon as they're inside the park, they tend to take it out and want to walk without that. And then how then do we actually enforce it? So we've put in place what we call COVID marshals, because people can get very rude also when you approach them. So we put, just to protect our staff, we've bought beeps for them, which identifies them as COVID marshals, so that when they approach you, you have your mask on your chin, then you know who they are, and also enlisting the support of the SAPS, that people that are not supportive, then we have people with authority to then enforce, to be able to actually do that. We've done a scenario for the next 3 years, going up to 2023-24. According to that, we're only going to be able to getting back to the 2019 figures by year 2023-24. That's how bad it is. And the other challenge is always that the cost of running the park, it remains the same, whether you get 2,000 people or you get 8,000 people, because we got to keep those engines running. We consume a lot of electricity to keep the aquarium going, to keep the water park going. We've started looking at virtual experiences that we can actually deliver, like your virtual visit to the park. The key issue is always how do you then monitor those things and how do you monetize them. We started this past weekend. We normally get about 2,500 people to come and watch the Dolphin by Starlight show, which is our signature show. But this year we could only get 500. So we then started producing it, also having a virtual content on it online. So we then allowed people that they couldn't come, and we directed them to our online platform to be able to then watch it. And then we created mechanism also to monetize it so that we're able to start recovering some of the revenues. Obviously, there's a lot of ICT investment that we now need to put in place to be able to then say, if people can't come physically here, but can they then visit the park virtually, and what sort of experiences they can do? How do we deliver some of the virtual slides and all those things which depict the experience of being at Tushaga Marine, but actually being at home? So we have a whole plan that we're wanting to roll out to then create that balance. But in the meantime, cost management is the key thing, and balancing and maximizing the days that you've got available becomes the key issue. And also pricing is another big issue. You know the balance that you need to have because you're now selling less capacity. So if you're selling less capacity, what should happen? So those are some of the things that we're looking at, but we've continuously been very much aware of that. Yeah.
All right, Nabo, thank you very much indeed. Can I just, before I let you go, and I'm going to come back to Nzimkhulu Msiwa in just a moment, but there was a piece on one of the international networks, I think it was at one of the big aquariums in Florida in the United States, that said without people coming to the venue, it has an impact on the exhibits, the animals, the fish, the dolphins themselves. Is that a worry? I ask you that just as an aside. Do your dolphins get depressed?
Well, I think I'm not an expert on dolphins, but I'm sure my colleagues at SAMRA may be able to answer that. But I saw one of the comments from one of our visitors that came when the aquarium just reopened, was actually commenting that the dolphins look very depressed because they haven't seen, because they're used to people. I think they're very friendly creatures. Yes. So
Yeah.
they do say that, but I'm sure my colleagues at SAMRA would be able to answer that. Yeah.
I think you handled that question very well. I didn't mean to ambush you. Mr. Msiwa, let me come back to you, Chairperson of the Provincial Planning Commission in KwaZulu-Natal. I want to put a question to you from one of our guests that maybe the rest of the panel could weigh in if we have time. I've got a very close eye on the clock here. This is Antonella Dacuna, who says, protecting livelihoods or lives. Is it a choice or can we do both? It's not a new debate, but it's a debate that has been reopened, Mr. Msiwa, after the announcement from the president last night. What's your view on that, sir?
Thanks, Jeremy. My view is that, and that's the view of the Planning Commission, is that we've got to do both. Simply because one of the key things that we're trying to achieve through our development strategy is the strengthening of the social foundation of the communities towards a better well-being. Now, that talks very much, and to do that, you need to have your economy actually sort of performing, and that then says to you, you've got to deal with the issue of the livelihoods. Because if the livelihoods are then compromised, you will also be compromising sort of the lives. So the view that is that you've got to do both. It's going to be the question again of sort of your risk appetite in terms of both areas. But as the Planning Commission, our view is that you've got to protect both lives and livelihoods.
All right, Darshan, let me come back to you now. Darshan Naidu from Coastlands. Again, if you could wear your human resources hat for me. Your approach to dealing with staff as we continue with the stress, and as all of our panel members have said, this is not going to end on the 31st of December. We're in for another 18 months, 2 years of this. Our lives irrevocably change. In terms of managing the human resources dynamic organization, I wonder how your thinking has changed.
I'm sorry, Jeremy. I've lost you on the last bit.
Okay. My question is how your thinking has changed in terms of human resource management. That's an abbreviated question.
I think, Jeremy, firstly, I need to totally agree with Mr. Khoza from Oshaka. Him and I are probably in the same boat and understand exactly what we're both going through. But to actually get back to your question, I think if there are people from large companies or small companies on the panel, I think what's very important is that your human resources professionals, directors, managers need to start exercising empathy. I think it's very important. We've recently heard quite a few cases about people committing suicides. The psychological impact that COVID-19 or the coronavirus has had on people has far-reaching consequences that will actually go on for years to come. And perhaps maybe some of the other panelists would actually want to comment on it. But if I had to answer your question, Jeremy, I would say we really need to start looking at the concept of being sympathetic and trying to come up with other ways to become creative in terms of job creation. You know, your traditional jobs in the hospitality industry are the chances of them returning in the next few months or years is definitely not the case. But like Mr. Khoza is saying, like he went virtual with the tours. In the same way, hotels are starting to do very creative things, like they're having to have we actually call them family Christmas parties, where it's just your family in a little room with a little Christmas tree, and you have a butler that will serve you, so you make it exciting, not advertising and just trying to put in an idea. But the point is, we need to become creative as HR professionals to create sustainable growth for these employees that have been psychologically devastated? I hope that answers you.
Darshan Naidu, I'm going to assume that this butler is wearing a mask.
Absolutely. It's a shielded, masked, gloved, suited individual.
I am pulling your leg slightly. Darshan, I'm going to take that as your closing remarks, and I'm going to thank you for that, because I just want to go to the rest of the panel very, very quickly. As we come to the end of our conversation today, and I'm going to ask all of you not to go on for too long, but just, and it's one question to all of you. Professor Sane, I'm going to start with you again, talking to the risk community. All of us are going to have a break, hopefully, mercifully. We're going to have a little bit of time off. It's going to be a very different type of Christmas, New Year that we're going to experience. But when they're starting to plan now for 2021, what needs to be at the top of the list? Because we're all going to start getting into planning mode very, very soon. Professor Ian Sane, let me start with you.
So I think that the bottom line is that everything is about business continuity in whichever sector you are operating. Within Right to Care, this is actually held by the financial director. The risk committee falls under the financial director. We have weekly meetings to adjust the modest risk items. We have monthly reviews, and I do think everybody needs to contemplate business continuity and needs to contemplate the occupational health and safety components of business continuity, and understand where their critical path employees are within the business, to actually understand if half of those critical path employees were knocked off by COVID, either illness and quarantine, and illness and quarantine can actually be a cycle. One family member gets COVID, then the person themselves get COVID, then they're looking after another family member, and so you could actually end up with someone being off for 6 to 8 weeks, and then obviously the question of training and death. So I think it's all about business continuity. And I also think, I do think the entertainment and leisure industry is the most affected. I do get that, but unfortunately, that's the only way, that's the place where we are seeing significant transmissions, and restrictions are required because people don't seem to be able to self-restrict. Thanks, Jeremy.
Professor Ian Sane, thank you very much indeed. Specialist in infectious diseases at Wits University. Also, your insights are much appreciated and much food for thought. Dr. Azar Jammine, I'll get to you now, because I know that you have a television commitment in the next 10 minutes or so. Again, just in terms of what would be on top of your risk planning list.
I think business continuity, I've been in that mode myself for the last 9 months as an essential part, as Professor Sane said. And in that regard, I think it is also essential to try and be creative and innovative, because the people who are trying to just dig their heads in the sands and go back to the world that existed prior to this crisis will be left behind and will lose their jobs and their incomes quite badly. And I'd like to just emphasize that it's not all doom and gloom. As Dr. Codrington suggested, there are a lot of activities that are actually doing extremely well out of the new environment. And it really is essential simply to be adaptive, sufficiently adaptive to actually exploit the opportunities that are available, and to make sure that you just don't dig your head in the sand.
I like the words that Darshan Naidu from Coastland said about exercising a little bit more creative thought, and I think that is well received. Dr. Azar Jammine from Econometrics, thank you very much indeed. Mzimkhulu Msiwa, Chairperson of the Provincial Planning Commission at KwaZulu-Natal, I'll give you a final word as you start to look forward now to 2021 on top of your risk list in terms of planning priority. What are you thinking about?
I think our view as the Planning Commission is that we will have to revisit sort of the domestic value chains. Given the fact that most of the wealth is created through global value chains, which basically is about sort of production, I think there has got to be more emphasis in terms of actually encouraging more domestic orientated value chains that could assist in terms of actually creating employment, increasing the incomes, and also raising up, say, productivity. So those are the three areas that we will have to refocus on: increasing productivity domestically, looking at increasing employment domestically through the domestic value chains, and also increasing sort of the incomes, and actually then mitigate the risk around those three areas. Thank you.
And I wish you all the very best for 2021 and what is going to be a very difficult year, I would imagine, at national, provincial, and local government. Ndabo Khoza, back to you, our resident dolphin expert. What's on the top of your list?
Thanks, Jeremy. I think since we're still allowed to operate with a limited capacity, one of the things that I've been pumping in the head of my team is that we cannot afford to be a super spreader venue or be seen to be a super spreader venue, because it's gonna kill whatever chance that we have of sort of swimming through this thing. So we are enforcing very strict health protocols to make sure that we retain our image as compliant, so that at least we are able to operate within the space that we are in. Financial sustainability is important. We need to conserve our cash and just, pull through, so that we are able to have sufficient cash, at least to keep the basic operations operating, and also continue to serve. So that therefore we are able to operate successfully within the limited capacity that we have. And then obviously our business continuity approach is also sustainable. Thank you.
Ndabo Khoza, thank you very much indeed, Chief Executive Officer, Ushaka Marine World. Graham Codrington, as the futurist, I'm going to give you the last word, with the full understanding that we know that you cannot predict the future for us, but what you can tell us as we end off this webinar is how to think about it.
Jeremy, I think that what the government's been trying to do over the last few months is to put all of this in our hands. So we had an initial harsh lockdown, and then I think the government, in trying to respond to the lives versus livelihoods debate, saying we've got to do both, is to say, well, it's now up to you. Do as much as you can. Get your kids back to school if you can. Get back to work if you can. But keeping in mind that this virus is still in the system. Now they've stepped in a little bit, and I think that's their goal, to just step in a little bit now, put the brakes on, make sure that we reduce the surge we're in at the moment. And I think if we all get involved in doing that, realizing it's our responsibility. The government's not going to save us here. The economy's got nothing left in it to give us. It's now up to us. If we deal with the surge, lower the rates of transmission, then as we head into the new year, we can apply those adaptability mindsets, those creative ideas, do the best we can. But we can't, hope is not a strategy. We can't just hope that this will go away. We've got to be deliberate, decisive, and conscious. So to come back to the question we were asked right at the top, should we cancel Christmas? No, but we should not do Christmas as we've done it in the past. We're going to have to be creative in ourselves as individuals and organizations to do things differently for still another few months, so that we can put things back together and hopefully minimize the long-term damage.
Graham Codrington, thank you very much indeed, and I look forward, if I can get my own plug in, of talking to you on my lunchtime program a little bit later on today. We'll talk about that offline, but thank you very much indeed to the entire panel. Thank you on behalf of the Institute of Risk Management for giving up your time. and participating in this debate with just a few days to go until Christmas. I'm really hoping that we've given you some valuable insight, that we've given you, if nothing else, just the outline of a blueprint to start thinking about 2021. I think the thing that struck me most in the past hour or so was that COVID-19 doesn't keep to calendars. We've all thought that that things will get better on the 1st of January. That certainly is not going to happen. So I thank all of you for your honesty, your integrity, and the valuable insights that you have given. Folks, at this point, I'm going to hand over to my colleague at IRMSA, Chris Palm, who's going to offer a few closing remarks because I have to reconfigure my life and get to my other job. So to all of you, thank you for participating today, and I've really enjoyed myself. Chris, I'm going to hand the camera, the floor, the microphone over to you.
Excellent. Thank you, Jeremy, and thank you to the panel. What a powerful discussion we've had this morning. And I believe that everybody in the session, all 170 odd of us, have really realized a couple of things. One being that this is not an all or nothing. It's not one or the other. In the middle somewhere lies the third option. And the valuable sharing of this information, I suppose, at least from a chief risk officer or a risk professional perspective, allows us to be able to make those decisions. And this, just before I thank everybody and we get to our polls that we'll just do at the back end of this morning's session, I just want to highlight a couple of things, and this very specific to the risk profession. And the question is this: have we actually, and there was mention about the importance of business continuity management, have we actually tested our business continuity management plans enough? Have we made sure that they are agile and that they are still relevant? And I think this is on the back of an opening comment earlier this morning that said, tomorrow is a holiday. Everybody's going on leave tomorrow. Well, this is the challenge to the risk professionals. We're going to need to do this today. We're going to need to at least kick in answering these questions. And that's not the only one. You know, the last or the worst phrase that a risk professional wants to hear is that the horse has bolted. Now, that also, and I think, Jeremy, it was you, on the back of a discussion with Professor San that said, well, the horse has bolted. And then adding the word again, because from the first phase to the next phase, or the second phase and the third phase, surely we don't want that. So the question is that this puts risk firmly in the lagging space. And risk is not about adding lagging value. It is about adding leading value. So the question to our risk professionals in the room today is, what are we going to do today? What are we going to do, and how are we going to do it to get our organizations, to get the public and the private sector ahead of the 8 ball? And we need to do it, and we need to do it very quickly. Then, of course, and thank you to Graham referring to our previous risk reports. Over the past 3, maybe even 4 years, we've been talking about the value of systems thinking, the value of scenario planning, and also the thinking about alternative futures. Yes, we cannot predict the future, but we can give ourselves some alternative options. And so where are we with this? And so the third one that I would like to leave with our risk professionals is, have we tested our risk response strategies for its effectiveness? If not, we are probably in the space of phantom risk management. We're just thinking about managing risk and not actually doing it. So what are we going to do between today and tomorrow? Well, we need to go back to our risk management plans, and we need to make sure that those controls that we identified are all effective, and that they're actually going to contribute to us doing less of the bad, meaning treating the threats, but also exploiting or leveraging the opportunities, doing more of the good. And then the last quick go-to that I would like to do, maybe just 3 points still, is the risk of the agility, the creativity, and the resilience that are built in our business models, our operating models. We need to make sure that we're on the back of this. And why am I leaving you with this? There was mention that we looked, or it was Graham, I think, that said that he read history books for the last year, and he learned from hindsight. So you will very clearly remember that we in the risk profession talk about using hindsight to inform insight, to create foresight. And it sounds a lot as if we haven't done that constructively yet, that we haven't learned from the past, and that we are still finding ourselves behind the 8 ball. And I think now's the time. Now's the time that we need to decide what are we going to do between now and when we go on leave, to reposition our organizations, reposition our risk response strategy, so that we can respond to what all was discussed this morning by the panel. So I want to ask if we could maybe call up the first poll, just before we exit, just to call up the first poll so that we can see your views in as far as your risk appetite is concerned. We would really love to just assess the poll around. So before this session, and having listened to our panel, has your risk appetite changed in the recent days up until now? And if you could just very quickly just participate in this poll. We've got 2 polls, so and we're already on time. So if you could please just access the poll. It's on your screen at the moment. It's in your chat box as well. If you could please participate in our poll. Whilst you're doing that, let me then just introduce the second poll that will run on the back of this one, and that is asking the question, did the president strike a good balance in last night's decision that was communicated? So whilst you answering this one, already think about the second poll. Did the president strike a good balance in last night's decision that was communicated? So while we run with the polls, and in lieu of time, let me thank the panel. Mr. Ndabu Khoza, Professor Ian Sane, Graham Codrington, Dashra Naidu, Dr. Azar Jamin, and Mzukulu Mzizwa. Thank you very much for your time. And this is all free, by the way. And so thank you very much. And Jeremy Maggs, thank you, like always, for your support of IRMSA. We really appreciate your participation and in the way that you have handled the panel today, just leveraging the discussion so that we could get all of this powerful insights and takeaways out of this session. And then, of course, to all the attendants, all the participants in this morning's meeting. We know tomorrow's holiday and the day after we're not going to come back. I've left you with a couple of challenges. And to all of those that have registered, thank you so much. We really appreciate your time. And we do believe, and I'm looking at the comments in my chat box, this was extremely valuable. Thank you, panel members, and just the value that we've taken out of this. And to IRMSA, to having this vision of putting this chat in and making it available within 3 days. Because as you all know, risk management is only as effective as its timing, as to get the information out there, to find ourselves in front of the 8 ball. And so with that, I would just invite you to complete the polls, and then thank you so much.